I am glad to introduce Dr. Jackie Persons, who is here to tell us about her career path for SSCP's How Did I Get Here video series. Dr. Persons received her PhD in clinical psychology from the University of Pennsylvania in 1979. She is currently the director of the Cognitive Behavior Therapy and Science Center, a group private practice in Oakland, California, and she is clinical professor in the Department of Psychology at the University of California at Berkeley. Dr. Persons served as president of the SSCP in 1999 and of the Association for Behavioral and Cognitive Therapies in 2002. She was named Outstanding Clinician by the ABCT in 2008. Dr. Persons' career is of particular interest to SSCP members because she's unusually skilled at combining science and practice. She is unique in her ability to conduct research while working in a private practice setting. Dr. Persons, please describe your career path and tell us about any obstacles or barriers that you overcame along the way.
Thank you, Sarah. I appreciate the invitation to do this for the SSCP, and so thank you to you. Thank you to the SSCP and to Bethany Teachman, who's the president right now, and I appreciate the invitation to do this. Let me say first, as an overview of my career, there's a way in which I've been doing the same thing pretty much every day for 35 years, which is that I have always been in clinical practice, and generally I'm seeing 15 to up to 20 patient hours a week. I'm starting to get a little older, so I'm slowing down a little bit. That's been my usual for all these years. In addition, I'm usually lucky enough to have a clinical faculty appointment. Earlier in my career, it was at UCSF. Currently, it's at UC Berkeley, and that means I'm doing some clinical teaching for the department. Usually, I'm supervising a student. Sometimes I'm invited to teach a course. And so, of course, that takes up some of my time. In addition, I usually have a piece or two of research going, something I'm writing up, some data I'm collecting, moving that piece forward. And then I have other projects. I like to do training workshops and teaching here in the local community. And lately, I've been getting international invitations, so I'm very happy about that. And I have other projects that usually I'm doing. When I'm ABCT president, of course, I'm doing that. When I'm not doing that, I'm always got projects. So I have all these pieces that I have been moving forward all this time. And so then that's like an overview. But there's some way when you ask me to describe my path, I feel like, oh, I've always been doing the same thing. That's not completely true, but that's my usual way of working. So then what I might do at this point is to start at the beginning and tell a little bit of a chronology and describe some of the hard points and obstacles. And I'm thinking I might also describe how I overcame or what I did about some of these obstacles. So it's really been interesting and fun for me to think about this for myself in getting ready for this presentation. And at first I thought, oh, I'll start telling the story when I finished graduate school and kind of started on my career. But then I realized that there's a way in which the way I handled myself in graduate school really laid the seeds for what came later. And one of the messages I always like to give to young people is to think carefully about your training and take an active leadership role in making sure you get the training that meets your needs and that you want. And so I would just say a couple of things about my own graduate training. I was trained at the University of Pennsylvania, which is a very lucky thing for me because I will tell you that when I applied to graduate school, I applied to 13 schools. I was turned down at 11 of them. And I was accepted at one, which was not a very good school, and I wasn't dying to go there. And I was waitlisted at Penn. So I got into Penn kind of by the skin of my teeth off the wait list. And I also came out of an undergraduate degree in anthropology. And so I had to make up my undergraduate courses in psychology in order to get into graduate school and go. And this was a long time ago, before the clinical psychology students had what everybody seems to have now, which is all these papers and conference presentation. I had none of that. I had nothing really. So I was just starting. Like, I was at the level that many high-level undergraduate clinical psychology students are now at when they're in undergraduate school. So I'm like starting graduate school and I'm just feeling my way and not confident that I'm going to make it, actually. So that's one thing I wanted to say. I guess the other thing I wanted to say was that I made my way in graduate school in the same way that I have made my way professionally, which is I'm like over on the side doing my own thing. And I'm not thinking that's always the best thing, actually, but for me, it is my way of operating. And so I did my dissertation not with a clinical psychologist, but with a cognitive psychologist, because Jonathan Barron, who is my advisor, I have a lot of emotion when I think about him. He was so helpful to me. So I had some ideas about psychopathology and particularly about thought disorder and schizophrenia that I wanted to develop. And Jonathan was willing to work with me on them, even though he's not a clinical psychologist, but he's a cognitive psychologist. His wife is a clinician, so he had an appreciation for clinical phenomena. So I'm over here by myself developing these ideas. I would write up something, an idea about something I had read, an idea for an experiment I was thinking about. I would write it up. I would put it in John's mailbox. He would read it overnight, and the next day I would be getting feedback from him about my ideas. It's like, this was amazing. So this was my graduate training, and I guess I would say another thing. I could talk for a long time about this, but of course I'm not going to. What I will say about I had 2 internships at Penn. Penn is the only, or one of the only PhD programs in clinical psychology in the country that will award a PhD without an internship. So I got my PhD, but I still needed an internship. And I actually did 2. I did my first one at Hospital of the University of Pennsylvania in the outpatient clinic. And the thing I would say about that is that to do that internship, I turned down an internship offer that I had from Tim Beck, which wasn't handled very skillfully, I must say. But I had been lucky enough when I was a graduate student to have some practicum experience over in Beck's mood clinic, which was so exciting. This was 1977, 1978, when cognitive therapy for depression was being handed around in mimeographed form. It was very exciting. David Burns was one of my first clinical supervisors. So I would tell you that behind my success is a lot of luck on my part to have access to these fabulous teachers and training experiences. But the thing I was going to say is, so Dr. Beck offered me an internship. I turned him down. And why did I do that? The reason I did that is because I wanted to go over to the outpatient clinic, not because I was going to get fantastic training, but because I was going to have a lot of autonomy. And I had about 5 projects that I had started that I wanted to be able to go over to Haverford State Hospital and collect data for a project that I was doing after my dissertation. During my practicum experience, I had the idea with David Burns to do a little research project. We were looking at changes in degree of belief in automatic thoughts and emotions during the therapy session. I was collecting data. I had all these different projects. So also at Beck's place, there was no space. Space is very important to me. I want my own office, and I want an autonomy, lots of room to move. So I was running all over doing my projects, and in fact, during my first internship year, I got in a little bit of trouble because I was not seeing enough patients. And I wasn't seeing enough patients for a couple of reasons. One is I was flying back and forth to Omaha because my mother was dying. And also, I was running all around doing all my projects. So that was lucky for me that I got the opportunity to both run around and do all these projects and still get these fabulous training opportunities. So So I think that's all I'll say, but I would say that it's not, my career started in the way I operate started in graduate school, actually. What happened after that is that in 1981, when I was finishing up my training, and I was so lucky, my second training opportunity, my internship was at the behavior therapy unit, Temple University. The director of the behavior therapy unit at that time was Dr. Joseph Wolpe. Is that fantastic or what? And I also had the opportunity to work with Edna Foa, who's been very important in my development as well. I finished up that training opportunity. At that moment, my husband, who I had married when I was in graduate school, his name is Jeff Perloff, which I will mention to you because you'll see his name on some of my papers. Jeff is an economist. Jeff got a job offer at UC Berkeley. And they were offering him, it was like, come and be here for a year and then we'll probably give you tenure. Here I am finishing up my training. He really wanted to go to California. That was a fabulous offer for him. In addition, his brother lives about 15 minutes, 20 minutes from the UC Berkeley campus. His parents lived in Los Angeles. I was happy in Philadelphia. I had starting to have a network there. The other issue for me is, should I go on the national job market? Which I could have done, but I decided not to do because it would have torn up my husband's career in a way that I just didn't feel prepared to do. And I had already started making my way, having the life that I've always had, you know, doing these multiple things, and it was kind of working for me. So we came to California. I would say I'm going to have to talk a little faster here, but let me say that those first years in California were some of the hardest. So I need to start talking about obstacles and impediments. So I came to California, this was 1981, and I had to build my professional life from the beginning. And it was very difficult, I think largely because I had to start at the beginning in a new place. I had to build a clinical practice. I arrived in California and I had data I had collected during my training years for about 5 or 6 papers. So then the way Jeff and I would work is, this was 1981, this is before the days of personal computers, right? So the way we would work is, he would go to campus during the day. I'm over in San Francisco starting to see a few patients. Plus, David Burns helped me get a job as a therapist on a project that Larry Thompson and Dolores Gallagher were doing down at the Menlo Park VA. So I was a cognitive therapist in a randomized controlled trial. I'm down in Menlo Park a couple days a week. I'm over in San Francisco 1 day a week trying to build my practice. And then in the evenings, I'd come home. I would meet Jeff on campus. We would go out to dinner, quick dinner. Then we would go to campus because Jeff got us access to some dedicated word processors and a space where we could work on our projects. So here we are sitting there. He's writing his papers. I'm writing my papers. We did this for a long time. So I would say that for me, some of the major, but this was really hard, some of the major impediments for me in getting my career off the ground, it was the first years that were the hardest, was, first of all, it was very lonely. It's lonely partly because writing papers is lonely, but it was also lonely because there were no models for what I was doing. I was kind of making it up as I go along. It was a 2-part thing. Number one, there were no models. And number two, I had this idea in my head, which I had learned in my graduate training, which is that I'm supposed to be an academic. So I have this feeling of I'm not doing what I'm supposed to be doing. So those two things together, I think, made it very hard. I think the way I handled the issue of no models is, first of all, in my graduate training, I had already kind of figured out how to do my own thing, and there's some way where it kind of suits me. The other way, another important model I had actually was my husband. So I'm married to an academic. So part of the reason I can have an academic life and produce research and scholarly things and write while being in clinical practice is, I think, the model of my husband. So that has been and also just the support for the time that job takes. Another piece of the solution for me, I think it comes out of, I had a fantastic conversation once at the ABCT with Connie Hammond. Now, Connie, of course, is one of those high-powered academics, and I was talking to her about my struggle with this issue of, I feel like I'm supposed to have done that. She said, the way I think, and this idea has been very helpful to me, she said, the way I think about this for my students is, I don't need everybody to be an academic. So, for example, Christine Podesky, who was one of Connie Hammond's students, what Connie said is, what's important to me is that my students make a contribution. And there's a lot of different ways to make a contribution, and certainly for me, Jackie, it's important to me to make a contribution that's greater than my clinical work. Christine Podesky is a fabulous example of a person who's not primarily a researcher, although she does some research, but she does a lot of professional writing, and her training, she's one of the best teachers and trainers I ever met. So that is a contribution. And so that idea helped me out. And so I feel like, I have a place to stand, I have a place to sit, and a lot of different, although I would have to say it took me years to kind of, now, of course, people look up to me. I think, I guess I figured something out. But for a long time, it was very hard because there were no models. Another thing that was hard for me was that I tend to be a perfectionist. So then here I am, I'm writing all these papers. I have about 5 database papers to write. And I'm completely alone for the most part. One of them I sent out to the Journal of Abnormal. That was my dissertation, actually. I got back a revise and resubmit. I was devastated. That's because I didn't understand that was a good thing. So that's what I mean. I was doing it alone. But after a while, I figured out. Anyway, so I'm writing these papers. Then I have about 5 of them all lined up. Each one of them, I'm thinking, has a problem. Here I'm back to my perfectionism. I think, I can't send this one out because it's got this problem. And I can't send this one out because it's got this problem. And I can't send this one out. So then I'm working endlessly on these papers. After a while, I got some understanding. First of all, I hired a therapist to help me out. Second of all, I had some, I don't know if I got this from my therapist, I don't think so. I figured it out for myself. I figured out I had a choice. I could either not send out any papers, or else I could send out papers that had problems in them. So I figured out I'm sending out I had to make myself submit these papers. The other idea I got, I think maybe Jeff, he said to me, you don't have to worry about whether these papers have problems that are going to prevent them from being published, because you know what? The editors and the reviewers are going to help you with that part. So then I started being able to send out my papers, and you know what? My papers got published, and some of them got published in really good journals too. So, but that was an obstacle for me, was to be able to take the risk of sending out these papers and getting them rejected. I would say that another obstacle, which I think any researcher could probably talk to you about, is that the reinforcement schedule is lean. I mean, like, you send out your paper and then do you get rewarded for this? No. Usually it feels kind of punishing, because what you get back is the critiques from, it's like, so I guess I would say that every once in a while you got rewarded, but still not a lot of external rewards, especially in the early years. So to me, the reason I could do this at all is because there's a lot of intrinsic rewards. You know, if you do not like sitting at your desk, thinking about things, writing, and like that, intrinsically, if it's not intrinsically rewarding to you, it is not possible to do it. So for me, that was the way I solved that particular problem. So the first 5-10 years, I would say, were extremely difficult. Some other things that helped me, especially with the loneliness and feeling being alone, was the SSCP, the ABCT. I had to build a professional community around myself and make sure that I participated. Every year I went to the ABCT and I presented. I did that every year. and I've been doing it for 30 years. And now I have a community of people that are my important friends and supporters. And of course, at the beginning, it's hard, but that was very important to me. So the hard years were the beginning years. Then I started getting my papers published. My practice got off the ground, and I felt comfortable enough to leave and have a baby and move. And at that time also, I wrote my first book. So now my first book, I remember I got pregnant just about the time I was signing the book contract. The editor wasn't too happy with me. And it took me 3 years to write that book instead of the one that the contract said. So that was my first book, which was called Cognitive Therapy in Practice, a Case Formulation Approach. That book, I get more external rewards for that than I had for these articles in these peer-reviewed journals. I have to say, I got some positive feedback. People read it, they would write to me, I would get invited to come and give workshops. So that made a difference for me. My practice was busy, so then I thought, okay, I'll take a little time off, have a baby. I moved my practice over to the East Bay, nearer my home. I had been in San Francisco. I came back to work soon after the baby, and I worked along for many years, doing my thing. And then what happened was, 1994, I applied for an academic job at UCSF in the Department of Psychiatry, and you know what? I didn't get it. This blew me out of the water. I guess I should say, so I'm going to back up. Before that, I was at UCSF. I worked with Ricardo Munoz. Ricardo was fabulous. He was running a depression clinic. He brought me in to do teaching and training for his students. I worked with Jeannie Miranda, who was one of his students. Jeannie and I did a series of research papers, that 2 or 3 of which were published in the Journal of Abnormal Psychology, in which we looked at mood state dependent schemas and stuff like that. That was really exciting. So UCSF was a little bit of an intellectual and professional home for me, and I started to think UCSF is my home. Then I got turned down for that job. Then I realized, you know, I think UCSF is not my home, and I think I need to build my own home. And so I started with my colleagues, Michael Tompkins and Joan Davidson. Joan is a very talented clinician who was one of my trainees at UCSF at the time, doing her practicum over in a thing I was training. Michael was a fully licensed clinician who was coming to me for consultation. And so we started the San Francisco Bay Area Center for Cognitive Therapy over here in the East Bay in 1995. So now I'm working in a group practice. Before then, I had always been in solo private practice. Having a group was fantastic. I had case consultation. I had a community of support around me. Joan and I had a ton of fun. And Michael, the 3 of us wrote a book, Essential Elements of Cognitive Therapy for Depression, Cognitive Behavior Therapy for Depression. We published a 5-DVD training series. And we did that in about 2000, 2001. So that we built a group private practice, very highly regarded. And here, maybe I could say something about the issue of money, because it's hard to do research in private practice because there's no funding. I mean, I did actually at a couple of points in my career apply for grants. Once I got a small grant, and a couple of years ago I got an SBIR with my colleague Kelly Kerner. So there has been some grant funding for my work, but mostly my research is self-funded. As Jeff would say, it's funded by the Persons Perloff Research Foundation. For the most part, I like to do research that doesn't cost a lot of money. And my own feeling is I can't see more than 20 clinical hours, or 25 at the most anyway. And then after that, I have all this time. The other thing I would say about the money is that somehow or another is like, because I'm doing the research, because I'm attending the professional meetings, because I'm keeping my skills up, and I think it's partly because I'm providing cognitive behavior therapy here in a community where it's in high demand, it means I can push my fee up in a way that allows me time to do my research and my other things, and I'm still doing I can make a good living. So I just want to encourage some of the young people, if you think about this, that you can make these numbers work, even if you're devoting a lot of time to these other things. At least I have been lucky enough to be able to do that. Some of it is luck for me. I did not come out of my training programs with large debts that I had to manage. So what I went most recently, and then I'm going to come to an end, is about a year ago, I realized I am in this very busy private practice where I'm trying to get some research done, and my colleagues are too busy to help me out and support me. So one of my young colleagues is trying to recruit subjects for a study, and everyone in my group says, yes, we will do it, but do they do it? No, they do not. As my colleague Michael said, it's the difference between wanting to help and actually helping. So I realized that the private practice group that I started with Michael and Joan now almost 20 years ago is often running in a direction that actually is not supportive of getting research done. And another thing that's changed for me is I'm 64 years old. I can see the end of my professional life. It's not too far away. And I start to realize the legacy that I want to leave behind is a clinical practice operation that supports research, and to build a little bit of an infrastructure that will support research. And so I last year left my group, which was extremely difficult, my old group, and I'm starting a new group with my two young colleagues, Paulina Edelman and Janie Hong, and we're building a new group which we're calling the Cognitive Behavior Therapy and Science Center. And our goal is to establish a center where high-level clinical practice happens and research happens too. For me, one of the most exciting things in the world is I'm sitting in my office, I'm seeing a patient, I am collecting data that guide the clinical work and simultaneously has the potential to contribute to a paper that I can write that will contribute to science. That is my idea of heaven, and our goal is to build an infrastructure that will allow for that kind of clinical research and other kinds of research too. And we will be making that up as we go along too, but I'm looking forward to doing that with Janie and with Paulina. So maybe a final obstacle and impediment, I would say, for me was I was kind of going along this path with my old group, and it took me perhaps a little bit longer than is ideal to figure out that my environment wasn't actually supporting what I wanted to be doing. So now I have to do something else, but I've done it before, I can do it again. So let me say that's a chronology of my professional path, and I would say that I feel actually extremely lucky in all of the many opportunities I've had to be trained by such fantastic people. As I was thinking about this, there are so many people who have supported and helped me along the way that I have not had the chance to mention, that I would like to mention. I'm going to have to start writing some thank you letters, I can see. And so I feel, in a way, even though there have been many impediments, I feel very lucky to have had the chance to have the career and the opportunities that I have had. Thank you.
Thank you so much.
Ah, my pleasure.